Today is Wednesday, April 15th. This is VOA's International Edition. I'm Lori Lunden in Washington. Coming up, a power struggle in the making as U.S. governors push back against President Trump's claims of ultimate power over their states' restrictions.
We don't have a king in this country.
The International Monetary Fund warns the global economy will likely suffer its worst year since the Great Depression. Also ahead, former President Barack Obama endorses Joe Biden.
Choosing Joe to be my vice president was one of the best decisions I ever made, and he became a close friend. And I believe Joe has all the qualities we need in a president right now.
It's all on today's International Edition. At the White House Tuesday, President Donald Trump said during a daily briefing that he has instructed his administration to, at least temporarily, halt funding to the World Health Organization over its handling of the coronavirus pandemic.
Today, I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus. Everybody knows what's going on there. American taxpayers provide between $400 million and $500 million per year to the WHO. In contrast, China contributes roughly $40 million a year, and even less. As the organization's leading sponsor, the United States has a duty to insist on full accountability. One of the most dangerous and costly decisions from the WHO was its disastrous decision to oppose travel restrictions from China and other nations. They were very much opposed to what we did. Fortunately, I was not convinced and suspended travel from China, saving untold numbers of lives. Thousands and thousands of people would have died.
Trump said the group had promoted China's, quote, disinformation about the virus that likely led to a wider outbreak of the virus than otherwise would have occurred. The U.S. is the biggest overall donor to the Geneva-based World Health Organization. Trump has been increasingly critical of the organization as the global health crisis has continued. Governors in the United States are starting to map out plans for reopening their economies in a slow and methodical process to prevent a new wave of coronavirus cases and more tragic consequences. President Trump has repeatedly expressed his desire to see the U.S. reopen for business very quickly, and on Monday he insisted that he has total authority over the loosening of those restrictions, even though the Constitution largely delegates such powers to the states.
The authority of the President of the United States having to do with the subject we're talking about is total.
New York Governor Andrew Cuomo, whose state has had more than 10,000 coronavirus deaths, on Tuesday ridiculed Trump's assertion.
We also have to be clear on who is responsible for each element of the opening. The President said last night that he has total authority for determining how and when states reopen. That is not an accurate statement.
New York has been America's hardest hit, but Cuomo said it appears to be turning the corner. He reported that there have been 778 deaths over the previous 24 hours, but said fatalities are leveling off and hospitalizations and the number of new patients put on ventilators are continuing to drop.
It's basically flat at a devastating level of pain and grief, but it evidences everything else we're seeing, which is basically a flattening at this level.
There have been close to 25,000 deaths and approximately 600,000 confirmed infections in the United States, as the nation's top infectious disease expert, Dr. Anthony Fauci, said the U.S. does not have the critical testing and tracing procedures needed to begin reopening the nation's economy. World leaders battling the coronavirus pandemic are hoping tests, technology, and a coordinated approach will help them begin easing tight restrictions on movement. In some European nations like Italy and Spain, the process is already underway, but it is a struggle to balance public health with economic well-being. The International Monetary Fund says the pandemic's impact on the global economy will be historically painful. AP Washington correspondent Sagar Magani reports.
Just 3 months ago, the IMF forecast global economic growth of 3.3%. Today, a breathtaking downgrade. The IMF saying the world economy will instead shrink 3%, its worst year since the Great Depression. Among specific nations, the IMF's looking at a 5.9% drop in the U.S. and 7.5% in European countries sharing the euro. It's projecting a big rebound next year with 5.8% growth, but acknowledges the prospects are uncertain. Sagar Magani, Washington.
The International Monetary Fund has approved a $500 million package to give 6 months of debt relief to developing nations struggling with the coronavirus pandemic. While the move is being welcomed, some finance experts say the world's wealthiest nations can do more, especially for the African nations on the list. VOA's Anita Powell files this report from Johannesburg.
The IMF's plan, which affects 19 African countries, will allow vulnerable nations to channel more of their scarce financial resources towards vital emergency medical and other relief efforts, the organization said in a statement. Eric Lecomte, executive director of the Jubilee USA Network, a coalition of religious organizations that works for international finance system reform, says the plan will provide much-needed relief to countries like the Central African Republic, Chad, the Democratic Republic of Congo, Liberia, Malawi, Niger, and Rwanda. He spoke to VOA from Washington via WhatsApp.
When we're dealing with the reality that, on average, countries across sub-Saharan Africa have an average of 50 critical care units, we know that they're not going to be able to deal with minor elements of the crisis, let alone more significant ones. In part, that's why we saw all the finance ministers across Africa almost 3 weeks ago now step up and say we need to be able to stop paying debts for all African countries, making a call to stop and suspend debt payments for $44 billion because they knew that was money that could be quickly invested, moved very quickly into economies to be able to get the ventilators, to be able to increase health systems so that they might be able to combat the virus.
So is the IMF's relief package enough? South African economist Iraj Abedian, who heads Pan-African Investment and Research Services, said the relief package is more symbolic than substantive. And Abedian said this plan doesn't improve Africa's ability to help itself. The continent's more developed economies like Kenya, South Africa, and Nigeria are not included in the package. The continent needs its developed economies right now, he said. And recent moves in the financial market, like the recent downgrading of South Africa's credit rating to junk status, don't help.
So to the extent that at this very wrong moment, South Africa has been downgraded, it reduces its access to the global capital market, it raises the cost of borrowing, and as such, it makes it so much less able to accelerate its capacity to help its own nation, but also in the neighborhood.
And Lecomte said wealthy nations can also do more. He singled out one in particular.
I think one of the challenges we're dealing right now with the G20 in terms of the initial step, which is suspending debt payments, is in particular China has been resistant in the discussion so far. China in particular, because right now China controls 25% of all lending, 25% of all debt in Africa. It doesn't want to change the price tag of that debt.
The African region still has the world's lowest confirmed coronavirus caseload, according to the World Health Organization. But African experts are quick to note gaps in testing and health infrastructure, meaning that even in developed nations like South Africa, there are likely many, many more cases than doctors know about. Anita Powell, VOA News, Johannesburg.
The U.S. Centers for Disease Control and Prevention is reporting the first national data on how the coronavirus is hitting doctors, nurses, and other healthcare professionals in the nation. Officials say between 10 and 20% of coronavirus cases are healthcare workers, but medical professionals on the front lines are getting some help through a telemedicine app previously used to track Ebola patients in Uganda. It's now being used by Johns Hopkins Medicine and other hospitals to monitor the health of first responders, doctors, nurses, and caregivers battling COVID-19. Johns Hopkins head of infectious diseases, Dr. Bob Bollinger, joins us now to talk more about how this works.
We're using a mobile health solution called IMOCA, and full disclosure, this is a technology that was developed at Hopkins, and I'm one of the inventors and on the board. But it's a mobile health technology that was originally developed to support public health programs in Uganda many years ago, and then subsequently has been used for supporting lots of health use cases over the years. And about 4 or 5 years ago, during the early Ebola outbreak, we developed a solution with IMOCA that would help monitor people returning from Ebola-affected areas in Africa, returning to the United States, so they could self-monitor themselves for symptoms. And that really led to a partnership with the Hopkins Biocontainment Unit, which was set up at that time to prepare for exactly what we're dealing with now. And so a system was developed to help health workers monitor themselves if they were to be exposed to infectious agents like Ebola and certainly like COVID-19. And so that was something that was put into place a couple of years ago. And then, of course, a couple of months ago, when we started to see uptick in cases and we're preparing for this current epidemic, Hopkins asked if IMOCA could expand this service to, more healthcare workers. And so it's really designed to help health workers very, very efficiently track their symptoms on a daily basis and report those symptoms. And there are really two objectives for this kind of monitoring. One is to make sure that health workers have access to testing if they need it as soon as possible, as well as information about the symptoms they may be having and support for those symptoms if it requires testing or medical care. So by reporting these symptoms, health workers can be linked to services that the hospital systems can offer for them, including testing. That's number one. Number two is it's a way to monitor symptoms very, very efficiently so that it can help make decisions about when health care workers are safe to return to work. And that's also important, obviously. So those are really the two objectives for the program.
Can you explain specifically how it works?
So health systems, including Hopkins, and there are others that are using it, will offer this service to their employees who are at risk for COVID, may have been exposed. They can very efficiently upload the app onto their smartphones, and then the app will walk them through a very efficient method for recording their daily symptoms. It's done very securely through both a checklist as well as a video and a secure chat so that they can actually be able to ask questions. And there's a team of trained people who are on call basically to review the data as it comes in, to answer questions and refer and triage the healthcare workers when necessary to the occupational health departments.
How far into the summer and into the fall do you think that we'll likely still be dealing with this? Or is this something that's just going to be now a way of life for the time being until there is a vaccine?
Well, this virus is not going to go away until we have a vaccine, an effective vaccine. The question is really what types of steps are going to be necessary to deal with it between now and that point in time, which is 12 to 18 months from now when we have a vaccine. And so what we're doing right now is we're trying to mitigate what is sort of the acceleration phase of this big wave that we're facing now. And the idea is to reduce the number of cases as best we can, but it's not going to go away. So after this initial phase, we're going to have to focus a lot on contact tracing and diagnosis. We've got to find ways to expand diagnostics and diagnostic capacity, as well as contact tracing, so we can identify cases similar to what they're doing in places like Korea and Singapore, where they're identifying very, very quickly cases, quarantining those people, doing contact tracing, getting their contacts tested, quarantining them if necessary, so that we can stop the spread. And it's going to take a lot of intensive work. We can certainly leverage mobile health and remote monitoring technology as well to do that, but it's also going to require teams of people to help with that contact tracing. But none of it's really going to be effective if we don't get more testing, because it's all about getting access to testing as quickly as possible. So you can identify cases very, very quickly and do the contact tracing. I think that's the new normal. We're going to get out of this initial phase, and then we're going to have to do a lot of very intensive public health diagnosis and contact tracing until we have a vaccine.
And do you think it's realistic that we can just open everything back up and go back to doing what we do in the beginning of May?
Oh, I don't think we're going to be able to just flip a switch. No way. I think we're going to have different strategies, and we can gradually begin to loosen up some of the recommendations, but it's not going to be like a switch goes off. If we get 1 million people in the country infected, that's still a fraction of 1% of the entire population, right? That means the rest of the population is still at risk. And as long as that virus is circulating in the communities and in the world, the remainder of the population is always going to be at risk for another wave. And so we can't really let our guard down. We can certainly begin to think about strategies to help begin to get the economy back moving again, get people back to work, but it's going to have to be done in a very different way than we did before this epidemic. I think it's going to be necessary to implement some of these strategies until, as you said, we have a vaccine that can protect us.
Johns Hopkins Head of Infectious Diseases, Dr. Bob Bollinger. Here are some of the other stories we are following at VOA. 3 potential COVID-19 vaccines are making fast progress in early-stage testing in volunteers in China and the U.S., but it's still a long road ahead to prove if they will really work. Initial tests focus on safety, and researchers in both countries are trying out different doses of different types of shots. South Korea's military says a barrage of North Korean missiles fired from both the ground and fighter jets has splashed down on the waters off the country's east coast in a major show of force on the eve of a key state anniversary in the north and parliamentary elections in the south. As the U.S. hunkers down to battle coronavirus, severe weather has left more than 1 million homes and businesses without power amid floods and mudslides. The storms that tore through the southeast on Monday left more than 30 people dead. Stay with VOA for all the very latest world news.